Well, hello, this is Paula Anderson with Paula Anderson Coaching and Consulting, and this video is going to be on anesthesia. So, anesthesia is a topic that I coded for about 2.5 years when I was working as a direct coder. And so, we're going to talk about what type of services are billed from anesthesia. So, we're just going to go through the different types of providers, the physical status modifiers. We're going to talk about a few of the Hicks-Fix modifiers, and then we're going to talk about some of the guidelines related to anesthesia billing and the formula. So, anesthesiologist is a medical doctor. He provides anesthesia for invasive and non-invasive surgical procedures, and the American Society of Anesthesiologists is the specialty organization for anesthesiologists. So, they can also perform pain management. Now, if you have a CPT manual, I would like for you to get your manual so that you can follow along with me. Now, another anesthesia provider is a certified registered nurse anesthetist, and this person is licensed to administer anesthesia under the supervision of an anesthesiologist with or without supervision. Now, you do have to have a Hicks-Fix modifier when you're billing for a CRNA. Um, in 1986, the CRNA became the first nursing specialty to receive direct reimbursement from Medicare. And there are going to be some resources that I'm going to put in the link of this video. Now, there are four terms that you need to be familiar with when you're billing for anesthesia or understanding anesthesia, and that's going to be anesthesia, which is the loss of sensation, anesthetics, which is medications for anesthesia cases such as morphine, fentanyl, oxycodone. And then analgesics, which would be pain relievers such as Tylenol, ibuprofen, and then analgesia, which is the relief or reduction in pain. There are three different types of anesthesia that we're going to talk about. The first one is general anesthesia, local anesthesia, and then regional anesthesia. So, general anesthesia is used for major procedures. Your local anesthesia is normally for in office procedures. And then your regional anesthesia can be billed for like pregnancy. So, those are the different types of anesthesia. Now, a nerve block is another form of anesthesia that is performed, and that can be performed during the anesthesia case as well for post pain management. Now, one concept that's related to anesthesia is called monitored anesthesia care. And so this is when the anesthesiologist or the CRNA, they're going to specify whether or not MAC has been billed on the billing record. So some factors related to monitored anesthesia care is the medication is administered through an IV line. There's monitoring of the patient's comfort level. There may be an increase or decrease in medication. And then, of course, it includes the pre-op, the intra-op, and the post-operative services. So there is a statement by the American Society of Anesthesiologists on monitor anesthesia care. And so that can give you guidance on how to bill for MAC. Now, before the case is done, there's going to be a pre-anesthesia evaluation, which is going to consist of patient history, physical examination, and then preoperative test results. So this is similar to an E&M visit. So they're actually assessing whether or not it's okay to proceed with the surgical procedure. Then there's also a post-anesthesia evaluation, and so this is evaluation during the recovery from anesthesia. Now, post-operative pain management must be medically necessary, and the surgeon must document the reason for post-operative pain management. Now, there are several Hicks-Fix codes that are used within anesthesia, and so I'm just going to go over some of them. So we have AA, which is personally performed by the MD. We have AD, anesthesiologist, MD supervising over 4 procedures. Then we have QS, which is for monitored anesthesia care. G8, monitored anesthesia care for a deep, complex, complicated, or markedly invasive procedure. And so this has to be indicated on your encounter form or your billing record in order for you to know which Hicks-Fix modifier should be used. Other modifiers, you have G9, which is monitor anesthesia care for patient who has history of severe cardiopulmonary condition. QK, medical direction of 2, 3, or 4 concurrent procedures. And then QS, monitor anesthesia care. So concurrent means that they're supervising more than one case at the same time. Other modifiers, QX, which is qualified non-physician anesthetist with medical direction by the physician. QY is medical direction of one qualified non-physician by anesthesiologist. And then we have QZ, CRNA service without medical direction by a physician. Now, your physical status modifiers actually have to go on every single uh, claim. So whether the patient is normal or the patient has some type of condition. So P1 is for a normal healthy patient. P2 is for a patient with mild systemic disease. P3 is patient with severe systemic disease. P4, patient with severe systemic disease that is a constant threat to life. P5 is more bound. Patient is not expected to live. And then P6 is patient declared brain dead. And so you need to find out what do the descriptions of these physical status modifiers mean. And so there is a resource by the American Society of Anesthesiologists, and they actually give more direction as to what qualifies as a P1, what qualifies as a P2. So for instance, P2 is patient with mild systemic disease, a current smoker, social alcohol drinker, pregnancy, obesity, well controlled, diabetes mellitus, and hypertension. Now, there are a few CPT modifiers that can be billed as well. So you have 23, which is unusual anesthesia service. You have 59, which is distinct procedure service. You have 74, which is discontinued outpatient hospital ambulatory surgical center procedure after the anesthesia administration. And then you have 99, which are multiple modifiers. Now, one of the things that you have to understand is how anesthesia is calculated. So it's not calculated the same way that you would calculate for a regular fee schedule. So you can't go to the Medicare fee schedule and actually look up the CPT codes for anesthesia. You have to go with the formula. And the formula is based off of the base plus the time, plus the modifying factors times the conversion factor. So your base is going to be what the value is for that particular procedure code. So 00100, and this is an example, has a value of 5. And so that's going to be the base. Then your time is going to be the total time of the anesthesia divided by 15 minutes. That's going to be your time. And then your physical status modifiers, your qualifying circumstances, all of those are going to factor into the modifying factors. So there is a value for each of the physical status modifiers. So P1 and P2, they have a 0 value, but P3 is 1, P4 is 2, P5 is 3, and P6 does not have a value. For your qualifying circumstances, so you can find a description of the qualifying circumstances in your CPT manual. So 99100 has a value of 1, 99116 has a value of 5, 99135 has a value of 5, and then 99140 has a value of 2. And so once you add your base, your time, your modifying factors, then you multiply that time, your conversion factor. Your conversion factor is going to be based off of the geographical location of where those services are being billed. So this is just a short little video giving you some information about anesthesia coding. As I said before, I did anesthesia coding for about 2.5 years, and I really learned a lot. Coding that specialty is actually one of the specialties that I recommend individuals to actually start off learning because it gives you a foundation of medical terminology, and then it just helps you to understand anesthesia procedures as well as the surgical procedures that are being performed. So to learn more about Paula Anderson Coaching Consulting, you want to go to paulaandersononline.net. That's paulaandersononline.net. I look forward to seeing you in the next video.